framework. About this encouragement of women's leadership in the disaster risk management. So that's what we are. So now we are starting. Good evening to everyone. It's 6 o'clock, and I take this opportunity to welcome Sri GVV Sharma, Member Secretary, National Disaster Management Authority, Sri Rajendra Singh, Member NDMA, Government of India. Major General Bindal is not here, ED and IDM. He has some personal emergency at home. So he has regretted and conveyed his good wishes to us. And I welcome Dr. KB Valsala Kumari, from civil servant from the Kerala state government. And I also take this opportunity to welcome Dr. Suranjana Gupta. She works with the Vairo Commission, and Ms. Naseem, she works at the grassroots level at the Swayam Shiksha Prayog based at Maharashtra. And another distinguished panelist, Ms. Margaret Arnold from the World Bank, Washington, D.C. She would be joining by 6:30. That's what she had mentioned. So I take this opportunity to welcome all of you on behalf of the National Institute of Disaster Management and on behalf of the National Disaster Management Authority that we are holding this very, very important webinar jointly with the NDMA. And we are grateful that all the dignitaries from the NDMA have joined, and also from the states we have Kerala state is represented, and many more states must be represented because we have crossed 240 participants so far, 232. The important, which we talk about, why we talk about this as an issue, and when we read literature, especially on the disaster risk management or the environment management or the development discourse altogether, what we have found, especially when it comes to the disaster management, whether we talk about 16th century, 17th century, or 19th century, or 21st century, over the years, we have found that for the risk management or for the protection of the society, and also for the protection of this environment, protection of nature, women have sacrificed their lives, especially in India. I'm talking about India. The global experience would come from Margaret Arnold when she would be speaking. And still we find that women are not there in the mainstream of the management of disaster risk. Probably, maybe because our institutional systems are such that if we analyze the issues when it comes to the gender-related issues, and 4 major institutions which we look at, which we look at the family, or we look at the community, or we look at the market, the workplace, and also the state. All those 4 institutions are getting empowered with their informal arrangements too, other than the constitutional arrangements. When we talk about the family, why we live in family together? Because family works for the altruism. So we sacrifice for each other, we live for each other, we die for each other. This is an official discourse. The second important thing which we talk about, the society. Society is for cooperation, helping each other. And that is why we live in the society, otherwise we would have preferred to live in the jungle. The third important institution which we are talking about is the workplace, market. And the workplace based on the principle of either, depending on if we are talking about capitalism, they have their own understanding and the principle of profit maximization. If we are talking about socialism and communism, then we talk about equity and welfare to everyone. And India adopted that as a welfare state. And Constitution of India has empowered women and men together, and they have taken as an individual entity. They are not empowered as a family. So each and every individual is empowered before the Constitution of India. So the state is making its role very clear that we are living in this society, and in this society, how society would be looking and based on the equitable distribution, equity, and a much more egalitarian kind of a system. So in this context, when we start analyzing the real picture at the ground, then we find huge differences, whether the family practices or whether the social practices or the workplace practices, and the states which give this all equity-based policy doesn't get translated in the same way which is state thought. So this is the time which we are thinking, and when the Honorable Prime Minister has said that look into vertically also that what are the problems and how these institutions can be strengthened by bringing the women's wisdom into the mainstream, that half of the population doesn't participate in our entire discourse of disaster risk management. I see that Margaret has already joined. Margaret Arnold, welcome you. Thank you. It's Washington time, must be very, very early for you. You have joined from the Washington, D.C. So to brief about this, that so in this discourse, I request Shri G.B.V. Sharma to give the inaugural address and also highlight that what NDMA is looking into as when we talk about this particular webinar as an outcome. I'm welcoming Shri G.B.V. Sharma. He's a very senior IS officer. He has been the Joint Secretary as Disaster Management also in the past with the Government of India. He also moved to when Odisha cadre officer. He was looking also into the disaster management, the Secretary Revenue, and then now he's looking after this NDMA. So what I'm saying is that he had contributed immensely when the SARC Disaster Management Center, I was part of it during this initiative and contributed at length in various discourse of the Disaster Management or SARC Disaster Management Center. I'm delighted to have you, sir, here, and I would request that keep the opening remarks as well as the setting tone as an inaugural address to see that how we should be moving and what are the expectations. So, G.B. Vishal.
Oh, thank you very much, Professor Santosh Kumar. Good evening to all. Mr. Rajendra Singh, member NDMA, Professor Santosh Kumar, Valsala, Dr. Suranjana Gupta, Ms. Naseem, Ms. Margaret Arnold, and all the participants. I am very happy to be interacting with all of you on this very, very important topic. Before I venture into the main topic, with your permission, I would like to start with a small personal anecdote.
Please, sir.
My wife is an IPS officer, and in October 1999, she was the SP of the capital district, that is Bhubaneswar district of Odisha. In those days, it was called Khurda district. And it so happened that the district magistrate, that is the collector of the district, was also a woman officer, and both of them were managing the district. And on 29th of October, when we had the cyclone, super cyclone, it is one aspect that in terms of preparedness and in terms of knowledge and in terms of overall steps which need to be taken, the situation in 1999 was very different from what we have now, hopefully. But on that particular night, when the cyclone had started with intense wind speeds, and the whole of Bhubaneswar, the roads were cut off and the trees fell down, the electrical poles and electrical wires stopped the traffic everywhere, and vehicles were stranded, and people had to rescue, people had to run. And in such situation, being the SP of the district, continuously, not only that night, but continuously for 3 nights without coming home, she had to take care of the situation by providing leadership when you did not have proper automatic electricity operated or battery operated saw cutting equipment was not available. But during that time, she mobilized her police manpower and ensured by leading from the front that physically the access, normal physical access were used and the trees were cut and the branches which fell down, they were removed and the important roads of Bhubaneswar were made all right. And it was such a massive work which involved great interaction with the civil society that even though this happened in 1999, even now, many friends in the civil society still remember her and her contribution, and they keep interacting with her because of the basic initiative which she had shown in terms of search and rescue operations continuously during those tumultuous days. And it so happens that it is also another interesting story that the then collector of the district is now a elected representative in the Lok Sabha. So anyway, coming back to the present theme, I would like to mention that what Honorable Prime Minister has stressed is not the traditional role where women were seen that, okay, in case of any disaster, first, when you are rescuing people, first give priority to women and children. So not just as people who deserve special support during disaster response, but the Honorable Prime Minister's point was not confined to response alone. He talked about the whole disaster risk management, which means that right from planning for mitigation or disaster risk reduction, for identification of the risk, then what measures have to be taken for disaster risk reduction, then what kind of mock exercises have to be done, and what kind of preparedness has to be done, and what are the do's and don'ts at the family level, at the household level, at the community level, at the district level, at the village level, at the district level, and all these areas, what are the preparedness levels, preparedness measures which need to be done, and how, let us say, we talk about the multi-purpose cyclone shelters which have been constructed in a big way in most of the coastal states along the coast in the last 20 years or so. The important challenge is how those assets are getting used in the normal time when cyclone has not happened, in the normal time, the peace time, how these assets are getting used. In most of the states, it is interesting to see that women have come forward in using these assets during normal time, whether it is women self-help groups programs, meetings, or whether it is skill development programs, or it is fish drying yards, or in whatever community activities, women have come in a big way. And in the shelter management committees also, we have women's participation in a significant way. The percentage-wise, the women's contribution is quite high. So the important point is, how do we recognize the role of women as subjects and as leaders rather than mere recipients of favor or help or humanitarian assistance during a disaster? Similarly, the role of elected panchayats in India, we know we have the elected Panchayati Raj system where the panchayats play a very important role. By law, there is a mandatory requirement for women's participation in these panchayats, but it is a challenge to see that the women who are elected in all these panchayats at all the three tiers, at the Gram Panchayat level, at the intermediate level, as well as at the district level, how they can get involved more actively in the disaster risk management. Similarly, in the urban local bodies and at the Jilla Parishad meetings also, it is important to see and give special training for women in order to see that this role of playing leadership is appreciated, understood, and pushed by the women. So that kind of empowering nature is required on part of the administration. And some people may have a question that women in India have got more basic problems. We do have instances which happen of insecurity, of sexual assault, But if we say that first the rule of law must be fully restored, and after that, then the rest of the activities will happen, it may not be the correct approach. Parallelly, we have to make a number of measures while the law enforcement authorities are mandated, while the judicial authorities are mandated to see that wherever such aberrations are taking place, wherever such violence is taking place, how law will support the women or the victims in an empowering manner. That is a different aspect. But without waiting for that outcome, how the disaster management apparatus will swing into action and see that the directions of the Honorable Prime Minister in the 10-point agenda with specific attention to the present topic, that is the agenda item number 3, regarding not just women's involvement, but also leadership in all aspects of disaster risk management. So I hope that this webinar will provide an opportunity for throwing up good ideas which can be acted upon. And I would also like to recall in this context that I had an opportunity to present the important aspects of the National Disaster Management Plan 2019 before the National Women Commission in New Delhi. And there also, this point was highlighted that not merely putting it in a document, but how effectively on the ground the whole system will work and see that the opportunities which are provided by law, which are provided by the policy framework and the plan documents of the disaster management are actually translated into action. That is the real challenge. And I hope that this webinar will provide all of us with ideas to move forward. So I thank Professor Santosh Kumar and National Institute of Disaster Management for having given this opportunity to me. Thank you.
Thank you very much, sir, for actually highlighting and starting entire discourse with a personal anecdote of the family, ma'am, how she worked and maneuvered and worked constantly and gave the leadership in the district in a real crisis situation is worth to be emulated. And this is the kind of stories that we need to document, that many of the places, how at different levels people have shown in the past the leadership, and that leadership actually get overpowered by this vulnerability of the women. And you did refer that we do not want just as a part of the or the recipient of the relief, but they should be the leader in risk management. And that's what we are gathered here, and which you highlighted the intention of the Honorable Prime Minister, that he is looking into that how women can brought in the mainstream in the management, and you highlighted example of central shelter management, the larger role in Orissa, and also reflected on how Panchayat, which we say in the 3-tier model of this, and the Panchayat is very, very important role to play, and which in many of the states in India they are playing. And despite these efforts, what we see is still that India, if we compare with 3-4 countries and our big economy like China, US, and the global average also, we find that women in India as a workforce is very, very limited to 30 to 33%. And where is the China, which we considered as a very close society, and there see that women, the working women, is 70 to 70 rate. It's also 60. See, this reflects which and where we talk about the similar, the fundamentals. Balaji, can you see that? Why?
Professor Santosh, sir, I think the audio is problem.
This noise is coming.
No, sir, from your side only the audio is problem.
My thing is okay.
No, sir, no, sir, rest of the members, panelist mic has been muted. Yes, you may please go ahead. We'll take.
Yeah, okay. Telling the basic fundamentals when go wrong, and then expecting as a leadership role probably becomes very challenging, as a member secretary has highlighted. And those fundamentals need to be corrected at the family level, at the societal level. Like I was saying, that women, this participation rate in the workforce and also in the literacy, if you have the illiteracy and much more, then probably we will have least participation in the formal sector. So these actually perpetuates the problem. One service example which the member secretary has given from the Indian Police Service, and quoting his wife only, that happened. And now I wish to have a view from Sri Rajendra Singh ji, member NDMA, GBB Sharma, and how he see and conceptualize, because his background is as coming from the Navy, Coast Guard. And this, the Coast Guard is also considered to be a very, very patriarchal. So how and what kind of arrangements which you think that in that kind of a situation, women leadership could be provided in the country? If we don't have to reverse the realities. That is to a kind of a, we always consider that we are still into formative stage. In the governance, especially handling the coast and maneuvering the cyclone, rescuing people and all. So his perception about the problem is also important to, as a very coming from, I consider, pardon me, I'm saying that is a very patriarchal belief, patriarchal system. Sources, our Coast Guard and all the policing we consider, but there's a time to break. I request Rajendra Singh to kindly break the myth with his own wisdom. Sri Rajendra Singh, member NDM.
Good evening, everybody. It is a great honor to be with all of you this evening on Honorable Minister and Agenda with a special reference on Agenda 3, leadership of women in disaster risk reduction. While women are equally impacted, if not more, than men by after effect of disaster. Their role in disaster response.
Rajendra Singh sir, respected Rajendra Singh sir, sorry for the interruption. Sir, your audio is not clear, sir. Can you please reset your audio? Is it possible?
What is not clear?
Your audio is not clear, sir.
Voice is inaudible, sir.
Now is it clear?
No, sir. Can you please restart your system? Is it possible?
Some problem the audio.
Good evening, everybody. Are you hearing me?
No, sir. No, sir. No, sir. Your mic is so much of noise.
Sir, you can.
We are restarting.
Headphones, I think.
Balaji,
Yes, sir.
Hi. Now you are okay, Professor? Okay, okay?
Sir, no, sir.
your audio.
Still your mic is problem, sir. If possible, can you please restart your system, sir?
Can we take another speaker in the meanwhile, sir, if you permit?
I'm okay.
Can you hear me?
Sandhu sir, we may go for the next speaker, sir. Maybe he will be joining within a minute.
Okay, now I need to request KB Valsla Kumari, a member from the Indian Administrative Service as a retired officer, after serving about more than 5 years in the government at various administrative positions. And she is aptly placed for the panel as she has done her PhD on gender studies from the Rutgers State University of New Jersey. United States of America, and also Masters in Women's and Gender Studies. And as a professional, she has been there in the Kudum Sri as an executive director, the state as a poverty eradication mission on the government of Kerala. And Kerala, we always say that one state where we try to emulate, and many of the examples which we give, and we say when we talk about this change which has happened in the lives of the women and the men and the total society as an output, while empowering women and bringing them into the leadership, we have seen and observed the change, the positive change. And every time referring back to Kerala, and I thought this is one state which is high in literacy rate, high in accessibility rate, high in empowerment rate, high in employment rate. So this is an ideal state to listen that what and how they have been able to make this kind of a dent when we say about this India is a very patriarchal society, and in how that Kerala's things are different with your academic background as well as your personal experience working in the field and representing government at various positions, principal secretary to revenue, secretary to housing, and so on and so forth. So this is the time that I think you should give some insights so that we can try to formulate in our strategy to bring them on the women as a mainstreaming leadership role. Madam Valsla Kumari, please.
Thank you very much, Dr. Santosh Kumar. Respected Mr. G.V. Sharma ji, respected Mr. Rajendra Singh, Dr. Sujana Gupta, Ms. Naseem, Ms. Margaret Arnold, and all the other respected members of the NIDM and respected audience. We all know about how patriarchal our society is. We just spoke about how Kerala is far advanced than many other states. Maybe that is right, it is right, but the point remains that patriarchy is not yet dead even in Kerala. Now, patriarchy is not something which only men have. Patriarchy, there are lots of women who are patriarchal, there are lots of men who are patriarchal. It's just the attitude of patriarchy that is ingrained in men and women right from their childhood due to the socialization processes that they have been subjected to. Now, we all know about the Sendai framework. We know about the Disaster Management Act. We know that we have institutions like NDMA, NIDM, state disaster management authorities, district disaster management authorities. But I am going to focus on something which is at a much lower level, but which I feel is of extremely important nature as far as disaster risk reduction is concerned, and that is the Panchayat level disaster risk reduction. The first responders in any disaster, as we all know, are the local people. And due to their proximity to the site, due to the fact that they are available, and due to their contextual understanding of the risks involved, the local people become very crucial stakeholders in response to disasters. Very often, the men folk are away at their workplaces, while the women tend to be at home doing their traditional domestic chores. So they tend to be more vulnerable to risks because they are closer to the sites of risks. Their comparative lack of education, comparative lack of access to health, and their triple role of production, reproduction, and community caring, as we all know, and their lack of networking, and speaking in comparative terms, lack of access to resources, lack of access to information, and lack of access to public space, which is usually masculine space, their marginalization from decision-making bodies in the disaster risk reduction scenario, all these contribute to their greater vulnerability. Especially, we've seen this during the 2018 flood and 2019 flood. And now, in the present context of COVID-19, all of us know from various reports that the assaults on women have increased tremendously. Now, I'm reminded of the song in the film called Bobby, where there is a song says, "Hum tum ek kamre mein band ho aur chabi kho jaye." So that is in a very romantic context that is sung. But here, the chabi is lost, but it is not your romantic friend who is with you, but it is your abusive husband who is along with you. So when you are during the time of lockdown, during the time when people could not go out, especially when men could not go out, they were locked in the house, and women were locked in their house. I'm not saying that this was a universal phenomenon, but in many houses and in many shelter homes and in many helplines, if you talk with the people who are managing the helplines, you will find that the number of cases seeking help with reference to intimate partner violence has really increased a lot. And there are figures which show that during the past 12 months, the number of cases have really rocketed sky high. So when it comes to giving leadership roles for women, I think the art of social distancing is perfected with great finesse. Women become invisible and forgotten when it comes to leadership roles in disaster risk reduction, thus impacting negatively the quality of planning. What I wanted to say was, once you try to marginalize women from all the disaster risk activities, the very quality of the disaster risk reduction plans get impacted very negatively. Because it's no more an inclusive affair, it becomes a highly exclusive affair, and hence the quality goes down very, very badly. Now, in cases where women are included, unfortunately, they are included as beneficiaries. Their critical role as knowledge producers hardly ever gets acknowledged. Their knowledge comes from not books, but it is a kind of experiential knowledge that is grounded in local, political, economic, social, and cultural realities. Now, a typical example is that of Kudumbashri, which all of you must have heard, which is an organization, which is a federated body of 44 lakh poor women. They have a three-tier structure. During the floods, 4 lakh volunteers cleared 2 lakh houses of debris and the houses and their premises, and 12,000 streets and also public offices. Nobody asked them to do it. It was a purely voluntary effort. They came forward saying that we are willing to do it. We are willing to make the houses habitable. And over 38,000 families became homeless, either temporarily or permanently. And you wouldn't believe what the Kudumbashri members did is something which all of us, especially the elite people, have to acknowledge, not only acknowledge, try to emulate in our own lives. They made spaces in their tiny houses for these 38,000 families who lost their homes and accommodated them for a period of 1 week, 2 weeks, 3 weeks, etc., which normal human beings won't do. I mean, what I meant to say is these are my sheroes. They are people whom we all have to respect a lot. Imagine giving 38,000 families without anybody prompting them accommodation for 1 week, 2 weeks, and sometimes even 3 weeks. Then they came forward to package all the materials that the government received from various quarters by way of donation. We have about, in the Kudumbashri, 241 Nutrimix units that makes Amritam Nutrimix. That is a kind of a baby food which is given not only for babies but also for pregnant and lactating mothers. It's made of wheat and soya and peanuts and sugar, and 241 units. They made around 9,000 kilograms of Nutrimix, which is valued at 6.45 lakh rupees, and gave it absolutely free of cost to the community. I mean, this is something, again, which all of us need to seriously think about. The spirit of volunteerism, the spirit of leadership that they exhibited without anybody appointing them as leaders in the community. Then relief materials worth 3.1 crores of rupees was again collected by these people by asking a lot of people, asking business people, asking ordinary people, even the staff members of Kudumbashri, they all donated, contributed together. and the relief materials alone worth 3.1 crore rupees was distributed by the Kudubashi members. Now, to crown all these activities, they took money from their small little thrifts, and 8.78 crores of rupees was collected by the women from their small little savings and gave it to the Chief Minister's Relief Fund. Now, would you not tell us that these are the women who are the real, true heroes, the true leaders of any disaster, acting on their own behalf, acting on their own instance, without anybody prompting them, without anybody nudging them? They saw what their fellow community, their fellow human beings were suffering. They came forward with all sorts of helps in whatever way they could. So what I am trying to say here is Kudumbashree is one of the best examples where you give them leadership roles, or where you can assume to yourself leadership roles even without anybody telling you. But then this kind of leadership needs to be institutionalized. And that is why in Kerala, in the local self-governments, we have a convergence mechanism whereby the CDS, or the apex body of all the neighborhood groups in a panchayat, are closely linked with the local self-government. And the local self-government not only supports a Kudumbashree, the Kudumbashree is used as a conduit for enumerating people for various programs, for distributing various kinds of goods and services to the poor people, to the indigent population of the state. So here is leadership. I know that I'm taking a lot of time. I'll just try to be very brief. So my first point is genuine decentralization is essential, wherein functionaries and even funds are devolved to the local self-government, with a stipulation that a critical mass of women will be brought into leadership roles. That should be stipulated, which is not stipulated as of now. Of course, Kerala has passed rules to ensure that 50% of the seats in the local self-governments are reserved for women. But not just the seats in the local self-government, but there are various subcommittees for disaster risk itself. Now, a 13th working group has been formed for the LSGD to look into questions of disaster, environment, and climate change. And in all these committees and all these subcommittees, genuine representation to women should be given. That is, I think we need to ensure that these are legally mandated clauses and not just, in the form of an advisory. Second is to put a mechanism in place so that strategic formal partnership with women's group like Kudumbashree or like any other SHG, especially if the poor women are formed. Third is a capacity development plan should be developed, in which the capacity building is continuous training on disaster risk reduction, continuous dissemination of relevant information. This reminds me of, I think it was Hurricane Mitch, and in Honduras, early warning system was delegated to women. A lot of people were skeptical as to whether the women will be able to do a good job, but they kept on, they were very extremely vigilant, kept on watching the changes minute by minute, and finally they knew that the hurricane is going to gain in intensity, and only because of their efforts, they evacuated the entire place and not a single death was reported. So that shows that women can be leaders, not just in distribution of relief, but even in early warning system. So what I'm trying to say is there should be continuous capacity building for these women's group as well as for men's group in disaster risk reduction. Then the next one I would like to emphasize is that women should be given equal representation in all the decision-making bodies related to DRR, right from planning to mitigation work, response, relief operations, rehabilitation, and even monitoring and evaluation through suitable legislative instruments and even monetary incentives. Perhaps the last point that I wanted to emphasize was regarding the attitudinal changes that are required, not just in men, but also in women. The patriarchy, which is the biggest block that is blocking, that's the biggest barrier that prevents women from coming into leadership roles. And I think among all the important barriers, the most important barrier is family as an institution. In many a family, the milieu inside the family is not at all conducive to women taking up leadership roles. we have taught our girl child, we have taught our girl children not to climb trees, as a consequence of which she is not able to climb trees when the whole area gets flooded. We teach our girl children not to whistle, as a consequence of which she is not able to whistle and capture the attention of a country boat that is flying by and rescue her own family. So unless this kind of gendered division of roles and responsibilities, unless it is changed, we are going to be patriarchal for many, many more centuries that are yet to come. And it is, I think, what we need to do on an emergency basis is to remove all the don'ts that surround a girl child. And if we do that, automatically she'll blossom into a beautiful leader. That is why I'm quite fond of repeating the story of the Amazonian women. We always thought that the Amazonian women were mythical women, but there are articles in National Geographic where peer-researched articles have shown that Amazonian women they were nomadic women. They are not myths. They were women who really lived, who right from childhood learned the use of bows and arrows, who learned how to domesticate horses, who learned how to horse ride, and as a consequence of which they were as deadly as any man, and they could go on fight with any man because they were nomadic. They had to protect themselves, so they learned fighting, and they were very deadly fighters. Similar is the case of Inuits, or the so-called Eskimos of Canada, who even today are highly skilled in hunting. And if a woman wants to go for hunting, she can go. So all that I'm trying to say is, please let us all, as parents, as mothers, as fathers, remove all the chains that surround our girl children. Permit them to blossom, and they will be the greatest leaders for the disaster risk reduction scenario as well. Thank you very much.
Thank you very much, Valslaji, for giving a very insightful example from Kerala. And you actually touched upon the basic fundamentals that if we wish to actually achieve the leadership role, we need to have an attitudinal change. And unless and until we bring this attitudinal change, which is coming from the patriarchal, and that patriarchy is not just get confined to the men only, but women are also getting affected by this patriarchy values and imbibing them for their construct. So in this kind of a scenario, which you have highlighted, that how in Kerala, the early warning system example was real remarkable, that how that women could see and save the lives of every individual. And the role of this Panchayats, where we're saying that they should be empowered, and Kerala is one state that we have seen in after 2018 and 19 floods, the way women maneuvered the entire post-disaster scenario as well. So your recommendations of capacity development and constant hammering of this this new value system, and allow girl child to bloom in the family. That's what we said in the beginning, that the family is for altruism, where we sacrifice for each other. But unwritten constitution of the family is actually reinforcing the patriarchal values both by men and the women. So here we and that which the outcomes which we find in most of the scenario, that these are becoming as a barriers. And so that you said that instead of just being a work of that, legislative framework should also be supported, and all the institutions which are actually dedicated for disaster risk reduction should have this kind of arrangements where the leadership of women could be accommodated, and for the larger interest of the society. And I'm really grateful to you for, and I would request you to be with us, because after this presentation, we will have a panel discussion and we will have question answer as well. So many questions are coming in the chat, but I will get back to you after just once we go through the first segment of listening to all the presenters. So I request Rajendra Singh ji to kindly deliver his address. Rajendra Singh ji, member NDMA.
Yeah. Sorry for the interruption that time. Good evening, everybody. It is a great honor to be with all of you this evening on Honorable Prime Minister 10-point agenda on disaster risk reduction, with the special duress on Agenda 3 that aims to encourage greater involvement and leadership of women in disaster risk reduction. While women are equally impacted, if not more, than men by the after effect of disaster, their role in disaster response has often been overlooked. With the Honorable PM recognizing this gap and identifying the need to correct it, we will aim to have greater participation from women in disaster risk reduction, so-called DRR, through various measures and strategies. Shri GVB Sharma, Member Secretary NDMA, Dr. Vatsala and Dr. Santosh have spoken with great detail and precision about this agenda, and I would like to take this opportunity to add a few points to the same. Women have historically been more vulnerable to natural disaster since gender norms and behavior expected from women in most society learn them with very few little space to acquire skill and access resources to help them build their resilience against disaster. This gender asymmetric in vulnerability to disaster risk is rooted primarily in geographic, economic, social, educational, and informational power imbalance in society. I would like to briefly discuss some of the regions that cause this imbalance that in turn result in a differentiated impact of disaster for women, since knowing the root cause of a problem often helps in solving the consequences that arises from it. First, I will touch upon the social and economic situation. In a regular daily life, when compared to men, women tend to have a lower social and economic standing with limited access to education and information in some societies. Lack of access to information often leads to lack of knowledge regarding evacuation route, facilities, and other disaster risk reduction information. This results in an inability to appropriately react when disasters occurs. Also, since men commonly hold decision-making power, especially in most developing countries, women are unable to make timely, often life-saving decisions which may delay their evacuation. Secondly, the gender norms, the inability to relocate to evacuation centers, so-called shelter, without the guidance or presence of one's husband or other male family member is yet another reason that women become the greater casualty during evacuations and relief operations. Gender norms shape basic survival capabilities as well. For example, women around for 60 to 70% fatalities in 2004 Indian Ocean tsunami because men were taught how to swim and climb trees at young age while women are not. Thirdly, I will touch upon the culture norms. Household chores are considered the primary responsibility for women. Post disaster, this burden further increases on women. Biological conditions and the social political environment also add to female vulnerability by limiting the opportunity women have to access support services for recovery. Due to the social setup in India, women are considered prime caregivers for children, and as a result of this, the differentiated impact of disaster on women translates to higher vulnerability for children in disaster. In reality, while female vulnerability in disaster is often highlighted, other actual and potential role in disaster risk reduction have often been overlooked. This is perhaps the first time in India that we are being encouraged to see the advantage and opportunity in enhancing the survival skill of women, thanks to our Honorable Prime Minister's agenda point in view of DRR, so that they have a more efficient response as well as greater role to play in the event of any disaster. I will not touch upon that, which is already talked about, the Sendai framework and all. I will come during this, in the current ongoing situation of COVID-19, different class of women are facing different type of challenges like aggravated poverty, violence, infringement of privacy, health. However, on the other hand, it is also a matter of great pride to share that 70% of world healthcare and social workers are women. In India, estimates show that qualified female healthcare workers account for almost half of the country health force and are among the more vulnerable groups. Women account for a staggering 88.8% of trained nurses and midwives. Women across India play a seminal role in plugging the medical supply disruption as well. India's self-help group, SHG, dominated by women, have contributed towards the production of masks, sanitizers, and protective gear to meet the burgeoning demand of the health sector. The gender issue must be urgently and effectively integrated into a disaster research, planning, mitigation, and organization practices. Women and girls have a defined role to play in disaster relief and reconstruction activities. By enhancing women's role with the support of skill building and training, we are in fact utilizing one of the most crucial resources that could play a key role in disaster relief as well as rehabilitation. Thus, following set of the initiative will help us in getting closer to our goal of female inclusiveness. A, the careful identification and nurturing the capability of women who can be potential leaders within the community and address the differential needs of men and women in the broader development process. Trained women can take up the task of educating other women, which empower them to take part in the risk reduction activities. Secondly, enhancing women participation in creating community awareness, providing search and rescue training, because when efforts are made to ensure a culturally sensitive environment for women to learn new skills, women are willing to share their innovation and come forward to learn. And I will quote the example of Uttarakhand. The State Disaster Rescue Force launched Mission Jagriti in 2019. It has decentralized stakeholder-focused approach to strengthen community-based disaster mitigation and response, with emphasis on participation of a women-only task force. The program consists of a combination of online training manuals, wherein there is a strong focus on imparting hands-on training. It utilizes modern methods like pre-recorded audio-visual, documentary, quiz, games, and so on, along with the training or demonstration like Nukkad Natak and educational video on local languages. The doorstep approach to this program become extremely useful in the time of COVID-19, where more than 25,000 people were trained in a matter of just 3 months, covering various departments. Training was given at COVID center and quarantine center and to all the sector for essential services that were gradually open post and during lockdown. Zoom app based training along with awareness videos will also give a decentralized ground based training or far-flung area across the state, keeping social distancing and with trainees. C, I will talk about the youth network like NYKS, NSS, NCC, Bharat Scout and Guide. Civil defense have fair gender balance because they, they compromise with the they comprises a pool of young and dynamic women volunteers who strive to bring gender equality in community-based disaster management. Many of these volunteers are part of the Apta Mitra scheme of NDMA, which is currently being implemented in 30 districts. There are currently 13 districts in India which have women volunteers team. The largest team of volunteers comprising women belongs to Kolhapur, Maharashtra. There are 93 women volunteers in this team who have been trained and are addressed as Abda Sakhi and have contributed immensely in saving lives in their community during the 2019 flood and even volunteered during COVID-19 by distributing food and educating the community and prevention method for the spread of virus. D, I will talk about women self-help group may be approached in village to initiate training program on disaster risk reduction in villages. Many of these self-help groups were involved in COVID-19 preparedness response and supported district administration in various activities. According to report in April, about 20,000 SHGs produced over 19 million masks and 1 lakh liter of sanitizers all over India. Since the production of decentralized, these items have been delivered to the masses without having undergo the logistics of transport. SHGs have also initiated the work related to the provision of ration or cooked food to poor and vulnerable families using the Vulnerability Reduction Fund or the support from state government and the local administration. In concluding remark, I will reiterate the fact that disaster, while devastating, can sometimes provide unique opportunity for development. Given the right environment, women can play a dynamic role in DRR. Women empowerment is the need of the hour in our country, and our efforts to include them in life-changing movements as well as train them to regain normalcy post any large-scale disaster will be the best proof of our intention towards making women gain equal access to quality of life as men. Since these women will be trained to become budding leader, they can act as a constant reserve for sustainability of DRR programs. It is highly recommended that women in society be assessed with a view to improving their quality of life as well as initiating positive changes before and after any disaster. As our Honorable Prime Minister has often expressed his desire to achieve Sabka Saath, Sabka Vikas, so it falls on us to ensure that his vision for development for everyone, regardless of gender or any other barriers, is truly achieved. Thank you very much, everybody.
Thank you very much, sir, for giving a very insightful, a kind of a roadmap which NDMA can think of, like engagement of women in not only a practical addressing practical need of the women, but also strategic need of the women. The strategic intervention of engagement of women in various cyclical mode of disaster management when we talk about response, relief, long-term recovery, risk reduction, and entirety management. where you highlighted about the SSG's focus and civil defense and NYKS, and how women have been engaged in management of COVID-19 as a kind of a very, very preventive measures. Excellent intervention. Yeah, please.
Santoshji, here I will mention, like in 99, Mr. GVB Sharma had said about the Paradeep Odisha cyclone. That time, that was around 10,000 plus. But now, if you see now, from 2000, onward, Indian Coast Guard have taken up the community interaction program with the fishermen community, all the villages which are situated on the 7,500-kilometer coastline. Till today, I think Coast Guard and Navy have taken up this program. Have conducted more than 7,000 community interaction program only for women and girls and the young children and the old people to how to survive when the cyclone or any disaster takes place. And this is the way. And if you see the Amphan and the research which has came in just in June, not a single death has taken place in Odisha, Andhra, Maharashtra, and Goa, because the community, the ladies and the women and the female and the girls are taking part constantly in this community interactions program.
For adding points that how women have been very, very effectively contributed in the reduction of the deaths or the mortality when it comes to the disaster management. Specifically, it seems I can conclude with this point that probably the DNA of the social thinking is changing. And in this change, the DNA, we might find good, bad, and ugly examples. Lot things to be still taken up for engagement of women into leadership, and many initiatives have already been taken which are showing results. And in a very complex society, India and the north, south, east, west, and depending on the social cultural reality, the gender discourse also changes. The role of women also gets changed. Important when we talk about the COVID-19 and violence and which had occurring and imposed on women. And women are into the reproductive, this role, which is the biggest strength of women, has been always seen by the society in terms of a weaker and kind of a thing, and imposed differently, and confinement into the Char Diwari takes place. So breaking the barriers, how that women, but today we are talking about SHGs very proudly, and bankers intervened, and they found when they were giving loans to the men and women both, in repaying the loans. So gradually that bankers also changed this entire discourse and going to the women, and they found that 98, 99% women are not defaulters and repaying the loan. It means that money which is invested by the bank is coming as a kind of a dividend. So now the power of the better half in the society, which we said that half of the population, what kind of a wisdom they carry, which we have not been able to actually acknowledge them over the years. And in the process, we have lost many things. India would have been much ahead, as we are quoting examples of Kerala all the time, what you have listened to. I see the Maharashtra. The another example, how which we are doing in Maharashtra, Dr. Suranjana Gupta, she represents Vairo Commission, and she is working extensively in India and also in many of the Latin American countries, other than her engagement in India, along with her this colleague, Ms. Naseem. Can I request Suranjana with Naseem highlighting those things what have been already discussed to take as a kind of a policy, as a framework in terms of strategic intervention of the future as a roadmap, that what should be the institution should engage with. Like we said that most of the SDM Madam was telling that most of the institutions were not into engagement of women still, whether we talk about National Disaster Response Force, State Disaster Response Force, and where the women have been groomed in the society as a kind of a differential power relations between the men and women, and that women are seen differently by different power groups. So how in Maharashtra, that was the barriers were broken and the women took the lead, and the entire sea change was brought at the local level, as we have seen the Kudum Sri in Kerala. Can you highlight, Dr. Suranya? I can invite you at this moment, please.
Hi, Professor Santosh, I think let Naseem Sheikh, I can't see her, but if you can request her to speak first, and then I will build on what she says. Okay?
Naseem, are you there? Can you listen to me?
She is there, it seems. Is she in the attendees? I cannot see her in the panel.
Naseem, are you listening to us? Okay, let her join.
Sir, may I know the name? Can you please tell me the name?
Naseem Sheikh.
What, madam?
Naseem Sheikh.
Yes, once again.
Just unmute her.
No, I could not see.
Sharma has been.
She says she's in the meeting.
She's in the meeting.
Yeah.
Not. Suranya, why don't you start, and in the meanwhile, Balaji will coordinate with him.
Okay.
Yeah, Balaji, can you coordinate with Naseem? You can send her to, to the number, and yeah.
Yes.
Please go ahead.
All right. So good evening, everybody. And thank you, Professor Santosh Kumar, for inviting me to this forum. It's really a privilege to be speaking here among such distinguished panelists. And let me briefly just mention a couple of things about the Vairo Commission. The Vairo Commission is a network. We see ourselves as a global movement, and our focus is on supporting grassroots women leaders to build more resilient, sustainable, equitable, socially just.
Sorry for the disturbance. I have converted an Naseem Sheikh panelist as a panelist.
Okay, so let her go first then. I'm fine. I'll follow Naseem's.
Yes.
Yeah.
Yes. Good evening.
Very good.
Ranjana, yeah. So I'm Naseem Sheikh from Swayam Shikshan Prayog. I'm working with in last 25 years with Swayam Shikshan Prayog, and so many disasters in India. I started my work with Latur earthquake, and now we are dealing with COVID crisis. So I appreciate both the presentations done by the Kudumshri and Sena sir. In both the presentation, I heard so many things about the women's situation in the society, and how the women are leading their leadership role to help their communities and their families. So I'm going to share some similar experience. So most of the women are most vulnerable for each disasters when we see the flood and the earthquake and the drought, all these things, but still women are potential leaders of their community. And in Latur earthquake, we started our work by organizing women, 700 women, to reach out more than 1200 villages to for recovery and rehabilitation. So within 3 years of time, where government is facing lot of challenges of corruption and all these things, and using the entitlements for other purposes, here women are mobilized, organized communities, and explain the priorities of their own family and why they had to rebuild their houses, and we are able to build 1 lakh plus houses in 3 years, and these 700 women, those who are social engineers of their community and architecture, they organize hundreds of women into the SHG groups. Now there is a big kind of across India, there is a big movement of SHGs where, yeah, some women are vulnerable, some women are not included into the mainstream, but still there is lot of potential women, those who has to include into the mainstream, and their leadership roles should be recognized. From my experience, like I saw the women from Latur contributed their experience, and they helped to the Gujarat women, and after tsunami and Bihar, through their learnings, their experiences, they mobilize women in Bihar and Orissa to take new roles for their resilience building, community resilience. So here, after the COVID, when the everybody like we all are close in our homes and cities, towns, these women shows uh, courage and dare to reach out their communities and assess their needs, priorities of food, livelihoods, and even social support system, like when the migrants are coming from the Mumbai and Pune, there is lot of discrimination in the community. So women organize themselves and they reach out and they did like the work as a mediator between health system as well as the gram panchayat for to establish the quarantine systems and provide the facilities. As Sir said, they arrange food for migrants during the quarantine period, and they arrange the PP kit for the health workers, and also they supported health worker to reach out the sick people and identified the people for the testing and early detection and screening and all. So as well as they not stop with their relief and recovery work, they started working on the livelihood regeneration through the MREGS program to help how the migrants can access the livelihood in their community. So from 700 to now, after 25 years, we like 2 3 days before only, like 30th September, we celebrated our 26th anniversary of our Latur earthquake. We are 3 million women across the India, like in Orissa, Bihar, Tamil Nadu, even Kerala and Maharashtra. So these women are organized, and they are supported through their groups and networks, and they have provided opportunity to learn new skills. So I'm going to request all the policy makers and our government and the dignitary people, we have to invest into the women to uh, to build their capacities, to provide them space into the governance, and also the resources to, after investing into the leadership, we will able to reach out last mile and inclusive, like SC and T kind of communities, inclusive development. I also create a good systems in the community which can work for the community and create a long term economic resilience community across India. If we can see the potential, women's leadership potential, and invest in the to build their leadership to address the DRR and sustainable development challenges. I will stop here. Thank you. Suranjana?
Thank you very much, Naseem, for giving
Yeah.
Suranjana, build on that. Then we Suranjana.
Wow.
Naseem ma'am, can you please turn on your video, because we could take one group photo. we could not, I could not see many of the panelist video.
Oh, but video, how I can turn my video?
Even Valsala madam also I could not see.
Yeah.
It's okay, no problem. Ms. Suranjana ma'am, you may please go ahead.
Okay. Okay, so I was saying, talking a little bit about Viro Commission, and we promote women's leadership in community development, and we work with organized women's groups, whether these are all low-income, poor women who are living and working in impoverished, urban, rural, indigenous settlements, and how
Take off your mic, please. Put on mute.
So our approach to women's leadership in disaster resilience is twofold. It has to look at what is it that organized groups of grassroots women are bringing to disaster risk reduction, disaster climate of their engagement in building resilience of their communities. How are they getting empowered? How are we shifting the way in which women are perceived? How are we shifting the way in which other actors, particularly local government, their communities, national governments, institutions functioning at different levels, be they local, national, or global, how are they relating to these women? How are they perceiving them? And what role do they see from them? So, with that, let me come to the issue at hand, which is women's leadership in disaster risk reduction as part of the 10-point agenda. So Viro Commission was one of the groups that right from the time that the Hyogo framework of action came into being, we were bringing grassroots leaders from different countries, including India, Turkey, Honduras, to the UNISDR at that time it was known, when DRR now, and we were saying that you have to understand what the kind of work that grassroots women are already leading on the ground, and you have to change this language in which they are only discussed as vulnerable. So I think that we are certainly on the right track when we talk now about empowerment, and you see that the Sendai framework has that language on empowerment, and we are very much on the right track when we talk about the leadership of grassroots women. Now, that having been done, the next step is how does one then build a conceptual and an operational framework that will actually build and sustain a new and different role for underprivileged women who are otherwise marginalized from access to resources and marginalized from decision making. How do we strengthen their position, and how do we support them, their leadership, to strengthen the resilience of their communities to multiple kinds of shocks, whether these come from climate related hazards or geological shock. So for this, we have to understand and try to build a that resonates with and builds upon the work that grassroots women's groups on the ground are already doing. So I just picked up 3 or 4 things that we in our network are hearing continually in our reports from the field. Of course, Naseem's work with Swayam Shikshan Prayog is exemplary and very strong. So one of the things that we see in many in which they get very highly data, which does not have in terms of looking at risk mapping, identifying vulnerable people, vulnerable populations, vulnerable structures, and therefore getting a very detailed, hyper-localized understanding of risk, or whether this is in the form of the kind of surveys that women's groups in Swayam Shikshan Prayog have done to gather data on migrant labor who return to their villages, or whether it's in the form of beneficiary identification, which our member group in Indonesia have done to ensure that social protection programs at the household level actually reach the households which are most vulnerable. And in their case, the village government and the subnational governments have formally accepted the listing, the data and the listing of households done by women's groups as part of their formal government database. So they are continually updating the database based on inputs from grassroots women. The second area which we see that women have done a lot of work and continue to do it over the years, particularly in relation to climate change, but is becoming increasingly relevant for the COVID crisis, is the issue of food security. So whether we see the way in which women have negotiated the 1 acre plots from their family in Maharashtra, which in the work that Swayam Shikshan Prayog does to grow vegetables and do vegetable farming, or the work that in the Philippines we have urban gardens and kitchen gardens that women's groups have created to grow nutritious food so that their costs, their household costs are reduced, but they can still have nutritious food. We are seeing a similar pattern in many countries. In Dhaka, there are urban groups of urban poor who are using vacant plots to grow vegetables. And we can also see that women are not only growing food for their families and ensuring that their families and communities have access to food, and they've also supported food assistance in many cases. So, for example, in what is now Telangana, the Deccan Development Society, for 20 years, the women who have done work on food sovereignty to grow drought-resilient millets were supplying millets and food for food assistance programs of the state government during the COVID crisis in the nearby town of Zahirabad. So you can see that the work that women have been doing over a long period of time, the investments made in building resilience to climate change and disasters over a period, how they are supporting the work that women are now doing to prevent, the destructive kind of nature of other shocks like COVID from completely devastating their communities. The third thing I want to mention is this issue of shock responsive social protection. World over, governments are trying to build in shock responsive mechanisms into the social protection programs. And here, again, you can see very clearly that in many countries, in the Philippines, you can see that grassroots organizations have done a lot of work on beneficiary identification. And this has been particularly relevant when they have wanted to provide cash transfers to disaster-affected households after the typhoon Haiyan. But similarly, in India, the work that Naseem talked about, they have also provided, women have also been helping migrant labor link up with the NREGS program. But they're doing more than that. They're not just helping to identify beneficiaries, they are providing end-to-end support by actually taking them to the Gram Panchayat office, taking them to the block office, trying to get their jobs made, their ID cards made. So there's a whole lot of support which at the local end is actually helping women's groups and communities who are extremely vulnerable to access government programs, including, I believe that heard from them was 23,000 people who they supported to get ration food through the the PDS program. So they're supporting large numbers of people to actually access government programs and therefore supporting the government to deliver programs. Now, just to work can be sustained. I liked very much the examples and the anecdotes that came from Mr. Sharma and from the lady from Kutumbashri. See, Mr. Sharma's example is because he talks about this. If women are given opportunities, the leadership can be outstanding. And I think that one of the things that I also see in his story when he talks about the relationship that his wife has with civil society is this, again, this investment in working collaboratively and what it does to build trust over a period of time. I think those of you who work in emergency services, whether it's the Coast Guard or the fire services, know that in an emergency, you cannot just start up work suddenly. That requires a lot of investment to create a well-oiled machine of very strong relationships and connections among different points and different groups and actors who have to provide a highly coordinated, effective response. So in that sense, also, I think we have to see the work that grassroots women are doing every day. These organized groups are involved every day in building relationships with one another, in learning from one another, and in building strong relationships with government and collaborating with them. And that is a very critical element of their ability to respond very rapidly in disasters. And I think the one part of the story about Orissa, which I want to add to, is that yeah, I'm going to give me 2 minutes, okay? One is that when you listen to stories about Filene, the officials will tell you that they actually were supported in the evacuation by women's self-help groups. So that's an important part. But 2 recommendations I want to make. One is that it's very important that we recognize women as a resource and formally at any level see them as resource persons and invite them to be resource persons, whether it's in the training institute. Margaret Arnold, who you will hear from, invited grassroots leaders many times to the World Bank to provide training. So they can be resource persons and trainers and mobilize their knowledge. We have to set up clear benchmarks for what constitutes inclusion at different levels. We have to provide flexible resources and money that allows women's groups to use them in the way that is necessary for crises. And we have to see capacity building, not just as continuous capacity building, but learning by doing. And for that, putting money in the hands of local groups becomes very important. And personally, I'd be interested to know how the disaster mitigation funds that we're talking about now and we're hearing about, how grassroots organizations, networks, and movements will be engaged in shaping the way these mechanisms reach the ground and can be used by grassroots organizations. Thank you.
Thank you, Suranjana, for giving this wonderful elaboration of that how the grassroots women can actually become the change agent. Especially, it's not only for women, it's for the social cause. And we say that if you make investment in them, and probably that largely the dividend comes to the society. It doesn't get confined to one individual or one family. It's a largely that. And your last 2 recommendations about providing opportunity and providing resources and being flexible. Quickly, before I invite Margaret, I was thinking when national health policy was getting implemented, and most of the time, we found that clinics in the mohalla and the rural areas used to open from 8 o'clock to 1 o'clock. And then we looked into this various states' data, and we found that large number of women are not accessing these public health centers. Then we found that probably maybe they are not falling sick, or maybe the men are much more than the women. But ultimately, when we did the survey, when we found that actually women, they get engaged during that time in the household chores. So they don't find time, even they are ill, sick, and whatever in devastating state, but they are not able to access hospital where they need to address the household chores. So the timing and the flexibility are required, and when it changes, recognizing that how they are located in the society and what kind of a work they are engaged with. And that flexibility is provided, then we will have better outcomes. So this is very interesting observation, and your experience you have brought in terms of risk management and all resources. and referring again and again to Margaret during that time, and how social protection and other things could be brought in. So, friend, I would not take much time here, and I would request Margaret Arnold in the World Bank as a global lead on the social development and social dimensions of climate change, which Ranjana was also again and again mentioning, that how women effectively could contribute, grassroots women, in the climate change scenario. So Margaret, she leads work on social resilience and locally approached to the addressing climate change issues. And she has been involved in disaster risk management. I remember distinctly it's in 1995 onwards, when the World Bank was having on two divisions at the GFDR. That time GFDR was not born. That time disaster management facility was there, and she and Alcida Kramer was there. So this is an opportunity for us to listen that how globally what grassroots women and the social protection, and especially in the time of COVID, you would be depicting with your experience, and you live in the other world. We say that the America, and we are talking about all as a resource person, the Indian conditions. Do you find any dichotomy and the gender relations, which is as a kind of a barriers in becoming the women leadership, or you find that still that can be facilitated very much with your experience? Margaret Arnold, I welcome on behalf of NIDM and NDMA.
Thank you. Thank you very much, Santosh. I hope you can all hear me okay?
Yes, yes, very well.
Great. So thank you so very much. It's really a pleasure and honor for me to be with you here today to discuss this important topic. I want to thank Mr. Sharma, Mr. Singh, all the co-conveners. Being an American, we're not very big on proper protocols, as you know, so please forgive me if I don't get the protocol right, but I really want to say thank you, and it's really an honor and a pleasure for me to be here. Let me first say that I'm going to first share. I just have a few slides I'll share with everyone. And I want to say first that it's really important, and I really appreciate that this event is framed around women's leadership and not the typical gender mainstreaming that we always talk about. No, it's critical that we focus on women's empowerment and how that can strengthen resilience to disasters, to climate change, to COVID, risk management in general. I think it's also important that we also note that we're very close to October 13th, which is the UN General Assembly has designated as the International Day for Disaster Risk Reduction. And the theme of this year's International Day for DRR is governance, meaning all the issues around identifying and acknowledging, planning and acting on disaster risk, right? Governance is, risk governance has come very much into focus this year, as we have seen around the world that so many of us were not prepared for a major pandemic like COVID-19. And governance is about how decision-making affects how things are done and how it affects people. And if it's not participatory, inclusive, accountable, transparent, it's not going to be effective. So this brings me back to women's leadership and the two key messages I would like to leave you with today, which are very much related to each other. One is that we will not achieve effective DRR without gender equality and women's empowerment. And the other is that effective DRR needs to have a much stronger focus on addressing the underlying root causes of vulnerability, particularly social inequality and exclusion. So the things we're talking about today. So let's first just take a look at why gender equality is so important for effective disaster risk reduction. This graphic, and I don't know if you can see my cursor, I'm focused on these three areas here. This graphic depicts the framework for the World Bank's The World Development Report from 2012, which looked at three aspects of gender equality in terms of endowments, which are things like health, social protection, education, opportunities, economic opportunities, and agency, having voice and freedom from violence. This is a few years old. It's from 2012, but it's worth having a look as it really makes the case that not only is gender equality important in its own right, it's important for the human rights of half the population of the planet, but it's also smart economics, it's smart development. So removing the barriers that prevent women from having the same access to men as education, economic opportunities, and productive inputs, it can generate broad productivity gains and help poverty reduction. And if we don't use the skills and talents of women, if we misallocate them and don't use them, that can come with a high economic cost. So it's important to note that. This report also showed that improving women's status, empowering women, feeds other development outcomes, including for their children. So there's an important sustainability aspect here. And it showed that leveling the playing field where women and men have equal choices to become socially and politically active, make decisions, shape policies, it leads to more representative, inclusive, and effective governance. And so just as we know that gender equality is smart development policy, it is also smart resilience policy. It's smart DRR policy. We're not going to build the kind of resilience we need without empowering women to shape their own lives and to contribute to resilience and development of their families, their communities, and their nations, as we've heard all of these powerful stories from Suranjana, Naseem, and others. So I'm still on this graphic, right? And so what this allows you to do is then look at all of these areas and apply that to disaster risk management. So I won't go through all of this, right? But you can see under endowments, and you can identify the gaps in each of these areas and then develop activities, policies to address those. So under endowments here, we know that women typically face greater mortality, not always, but quite often in disasters. That we know that education is a good indicator of resilience and adaptive capacity. We know that the disaster risk management profession is male dominated in most countries. And that's, it's normal. It reflects the roots of this sector, right? Coming out of an emergency response phase, civil protection, military in many cases, right? So this is normal, but as we have been talking for decades now about shifting more to risk reduction and not having to, the emergency response capacity is critical, but we need to focus more on the risk reduction, the vulnerability reduction aspects of this. And that's a cross-cutting area across all sectors. So we need to broaden our view of what is DRM and how we address it effectively, and so this is, in DRM, it's also has quite a heavy focus on engineering and things like that. So these STEM, right? Science, technology, engineering, and math, where men are much more heavily represented than women in this field. So we need more women in STEM to address this. Under economic opportunities, women can often have less access to credit and savings to absorb losses. Their burden of care increases quite often during disasters and crises. A lot of times women, we've heard so many stories about women getting organized in relief and recovery work, but typically there, where men often will be paid to clear debris or something, women often perform non-remunerated work in relief and recovery, so they're not paid for it. And then the recovery phase, looking at how their rights are protected and things like that. And certainly in the area of voice and agency, we know that gender-based violence increases in most post-disaster contexts. And we also have growing evidence that women contribute to broader resilience for all. This is not just about women, this is about everyone when they're empowered and put in decision-making positions. So what can be done about this? This is another heavy slide that I won't go through in detail, but it lists here just a few of the actions that can be taken just as examples to address some of the gaps identified on the last slide. And now, importantly, many of these focus, again, on recognizing how existing social inequalities can be compounded by disasters and emergencies, and also the importance of recognizing and formalizing the role of women at the local level and at national levels in building resilience. So again, a focus on governance and having women at the table in the decision-making process. We have so many examples, particularly at the grassroots and community level, where women's leadership has really paid off in terms of building broader community resilience. So in Ethiopia, in Kenya, and in India, the World Bank has invested quite heavily in women's savings and loans groups through government programs to help communities better manage risks associated with drought cycles, by generating income, preserving assets, and improving food security, as Suranjana noted. We've heard a number of examples, so I won't go into more just in the interest of time. But I think that the key point here is that there needs to be policies and programs dedicated to actively promoting women's leadership in, oops, sorry, I messed up my slides. To actively promoting women's leadership in DRR and resilience building. It's not going to happen on its own. It requires shifts of norms, attitudes, and behaviors, and that takes a lot of time. We're talking about, personal, at the individual level, paradigm shifts that need to happen. These are about, again, cultural norms, attitudes, and behaviors that take time to change. So the work needs to start, and it needs to have started already. It can be done, and I'm just going to show one last slide, which I thought was really interesting, around countries led by women in COVID-19. I've been seeing a lot of articles that women-led nations are handling the pandemic more effectively. This chart is from an article, the link is there if anyone's interested in having a look at it. It was comparing similar countries in terms of their size and level of development that are female-led and male-led, and the number of COVID cases per million through May 19th. So in the first two bars, it's Taiwan and South Korea. Taiwan is led by a woman. Norway and Ireland are compared, and you can see the difference there, and Hong Kong and Singapore. So all those three countries, Taiwan, Norway, and Hong Kong, are led by women, and we know we've seen other examples, Germany, New Zealand, also led by women. This can be done. And I think we also need to think about disaster recovery. I'll just turn my slides off now so I can be seen a bit better. So disaster recovery opportunities to advance gender equality and women's empowerment as part of, we often talk about building back better. I know, I'm sure many of you in the DRR community, we often speak about this post-disaster window of opportunity that opens after a disaster to do things differently going forward, right? The idea is that the disaster brings a momentary period of raised awareness of risk, of monetary resources, and both a real and metaphorical blank slate upon which people can build more resilient communities or initiate other changes that may not advance during quote unquote normal times, right? Now, experience has taught us that this window of opportunity is not a given, and it must be managed carefully. So, for example, there's a lot of pressure to get people out of tents and back into houses after a large earthquake or other disaster, to spend resources quickly. And that often trumps the need to ensure quality of construction or to engage communities meaningfully, that to ensure sustainability. But I have to say, based on my 25 years of experience at the World Bank and in a lot of disasters, a key area where I have seen progress made in this window of opportunity has been on gender equality. And it can be often addressed speedily and very well in the recovery process. So things like deeding new constructing houses, both in the women's man and the man's name, including women in housing design as well as construction, promoting land rights for women, building non-traditional skills through income generating projects. So a lot of the things that you've heard in the examples, these can all be done quite easily and quickly. So this brings me to my second message about calling for a need for the DRR community to focus much more on addressing social vulnerability. And it also brings me back to COVID-19. So like many other disasters, COVID-19 has laid bare existing social inequalities, including in wealthy countries. Even in New York City, where I come from, African Americans have died at twice the rate of white Americans. In Brazil, indigenous peoples are dying at twice the rate of other Brazilian people from COVID-19. We know there'll be millions more falling into poverty due to COVID-19, and many at risk to severe long-term impacts resulting from food insecurity and lack of access to education due to the lockdowns and confinements that we needed to stop the spread of the disease. It's interesting that from what I've read, men seem to have a higher mortality to the coronavirus. But on the other hand, women are feeling the social and economic impacts more, again, due to existing inequalities. Around the world, women generally earn less, hold less secure jobs, they're in the informal sector, they're more, their capacity to absorb shocks is less. We're seeing grave increases in domestic violence, as was mentioned. And we'll have long-term impacts of what some are calling the burden of extreme care that women are bearing. Women are more likely to quit their jobs now and stay out of the labor market to care for children, for elder family members. But on the other hand, we're also hearing many stories where grassroots communities, grassroots women in particular, are organizing to address COVID-related food insecurity, distribute sanitizer and PPE, run community kitchens, disseminate information, and provide financial support to fellow community members. And at a national level, as I showed you this interesting chart around countries that have a woman leader that are typically faring better in terms of the spread of the disease and mortality. Now, there's a lot of literature around how women are more risk averse than men. We have different perceptions of risk and different ways of managing it. And, it's not to say that, we always have to have a woman leader. That would be nice. But there's also the point that having a woman leader is a signal that that people of diverse backgrounds and diverse perspectives are at the table when that happens, right? This is the point. So, so it seems that from what I've been reading, and I think there should be more in-depth studies on this, but that the countries that have women leaders, they have considered more information sources around developing policies to address coronavirus. Here, my point is just that as we hopefully come out of the emergency phase of COVID-19 soon, and we're talking about, globally and nationally, thinking about sustainable, resilient recovery or building back better, however you'd like to call it, the social vulnerability and gender equality needs to be systematically institutionalized into the policies, systems, the procedures of governments and organizations at every level to effectively build better communities and societies. When we always say build back better, tends to focus on the physical buildings, right? But it needs to be so much more than that. Because women's empowerment is it's not, as I said, a matter of human rights for half the populations. It's really essential for a sustainable and resilient future. It's for everyone, right? Patriarchy, it hurts men as well. It hurts all of us. So it's really critical to get this right. So I will leave it there. And thank you again for listening and for inviting me to this important conversation. Thank you very much.
Thank you very much, Margaret. I would request you to kindly stay for some more times, just 15-20 minutes. We will have question. It's very interestingly you highlighted about these social vulnerability issues, and especially coming to endowment, opportunities, and voice and agencies. And we have the senior level officers who are chairing, and they are providing leadership to the country. And I would request Sri G.V. Sharma to reflect and that how your global experience and the thing which you are talking about by citing an example from the women leadership role at different aspects, and especially in the management of COVID. From here, when we talk about integrating social vulnerability in the Build Back Better, in the discourse of endowment, opportunity, and voice, and in transact with the various cyclical arrangements of disaster risk management in times of sustainable development goal, climate change, and then Sendai framework. How, as a kind of a roadmap, a strategy can be drawn. I just like to have a reflection from our members. So,
thank you, Professor Santosh Kumar. I think we should give some time for the interaction from the participants, but I will take your question very quickly. What I would like to think is that it is true that effective DRR is not possible unless you have gender equality. So that is stated by Ms. Margaret Arnold, and it is perfectly true. But my only point is that we should not wait for gender equality to be achieved and then the DRR will start. It is not like that. The very process of involving women right now, even if we do not have gender equality in the desired sense, even then it should not inhibit us from attempting to have a greater role for women, not only as participants, but also as leaders in different aspects of disaster risk management. I think parallelly, all these have to be attempted, and we should not wait for any one process to end so that the other process can stop.
Very nice.
Thank you.
The coexistence that one should work and another process, where instead of waiting for the ideal thing to happen. I'm reading out the questions. Any panelists who would themselves want to say something, then you can say, and there's more questions which has come up. The one question is come up that how the women empowerment and in the process of DRR, the leadership is established at the rural areas, in the rural programs, in the rural development. So it's open to all the panelists. Anybody would like to react to this question. And the second question which I would read is in terms of the question which has come up that disaster management plan is a holistic manner should be a good beginning by incorporating gender. So these two the panelists are free to react, and maybe we can have like to react. So Ranjana, would you like to add on here where the Naseem said, and the question is coming from the rural area, is that how to institutionalize what Margaret says and what the question is coming on, that social vulnerability is so high in the rural areas, and we kind of bring that to leadership and the places of Maharashtra and all the Islam and we don't see the experience and their view. How can you, both of you can react on this so that we can have our future strategy for this as a recommendation for from this webinar?
I'm so sorry, I couldn't hear the question properly. Sorry.
No, what I'm saying, the question was that the few examples are coming up from the rural areas, but how this could be taken as in the leadership role and since the disaster management planning is very holistic, so how that social vulnerability can get this into integrated in the framework of what Margaret has said. I'm just mixing 2-3 questions together and I'll put before you so that the 2 examples came from the grassroots, yours and Valsla ma'am. So Valsla ji, are you there?
Yeah,
If I understand you, the question is how do you reduce vulnerability and how do you get the strategy around gender into the planning?
So vulnerability to leadership role.
Yeah. Okay. So I'll only say one thing because I think it's a very important piece. I didn't get to mention this in my remarks, but I think that for us, both the COVID crisis and the work on climate is showing how critical local organizing is. The local context-specific solutions and the lockdown, the disrupted supply chains are also bringing the importance of local. And at the same time, this has to go hand in hand with the decentralization process. So we have to look at both these processes together and see where they are converging. And I think I already spoke in depth about the importance of decentralization, but I want to reiterate that because having women in the panchayat with women groups outside the panchayats and the two being continually in dialogue in order to influence one another and bring resources and opportunities to one another is critical. And the other thing I think we have to look at is how does government sit down with the organizations and networks who have invested heavily in these processes to co-create solutions and frameworks? Because I think that we cannot say that any of this happens very automatically and naturally. To say that would be to undervalue the investment that has been an organization. I think we should look at how there should be greater collaboration at multiple levels, local, national, definitely. We ourselves as a network are involved in co-creating a program with the Asian Development Bank where we had a small project, but we are now building a larger initiative called the Community Resilience Partnership Program, which we are co-designing and collaborating with them on. So let me stop there.
Thank you. Thank you for reflecting. Valsla ji, can you just react on this question? Are you there?
Are you asking me?
Yeah, please.
Yeah, I couldn't hear all the entire question, but from the little bit that I heard, I think I will say that I agree with Mr. GVV Sharma, who said that we cannot wait for everything to be all right, and we need to start, right away. There is a saying which says that unless you get into the water, you won't be able to learn to swim. So let's get right into the action. That's what I feel, and we need to work at multiple levels. See all the gains that we have made in the women's empowerment sector has been basically also because of the strong women's movement that we had. So I believe that unless there is an independent women's movement, a movement that is independent of all kind of political influences, political in the sense of party political level, so that women can have networks among various small little groups, we will not be able to pressurize the lawmakers. We will not be able to pressurize our parliamentarians towards framing laws that will help women and men as well to have an equal society. So I think it's very, very important that we start working right away, not wait till gender equality is brought in. Secondly, ensure that, or rather facilitate women's group to network very well and to form independent women's movement so that they function as a pressure group to make changes in society.
It's a very insightful thing that one day we accept that we have to go side by side parallelly. We don't have to wait for the ideal situation to come and the women groups to be empowered and to be taken up. I just And again, drawing from the questions which are coming up, that how engagement of youth, civil society can actually transform the things. To supplement, to just add one more thing into this so that panelists can comprehend and mention. Are we also recommending at some point, knowingly or unknowingly, that it is women have to bring or break the stereotype, or the men's also have the responsibility, or men's group or the youth group or others also have to join hands? What is your take? Let's say Margaret at this, and then Vatsla, Vatsla, I'll come to you.
Do you want me to respond to that, Santosh?
Yeah, please. You're talking
Sure.
about government and other social responsibilities.
Yeah. So I would say it is absolutely everyone's responsibility, right? These are as I mentioned earlier, these are social, cultural norms. Gender is a social construct, so we all need to change our views and minds about it if we're going to make change. And I think it's a really important point, and I hope what I was saying didn't come across as that we have to wait for full gender equality before we have anything else, as Mr. Sharma was saying. We absolutely need to, it takes time, right? Changing cultures, think about it, how long it takes. It takes a long time, and it needs to happen in every area with education of young children around gender roles and around DRR. So they can go hand in hand. And have, we need leadership at the top level to really embrace these ideas and provide leadership, but also focus on the local level and educating children from the beginning on this.
Thank you. Any comments from?
Yeah, I think this has to start basically from home. We have, all of us know the story of Arjuna's son, who was in the mother's womb, and he heard how to get into the Padma Vyuha, and but unfortunately he couldn't hear how to get out of the Padma Vyuha. So the message is that a child's education starts right in the womb of the mother. So I mean, it has to start not just with the woman, but with the father too, with the grandmother, with the children, everybody. And then I feel that education has an important role to play. The syllabus can easily include chapters, one chapter or two chapters, right from nursery level, in a very simple language. The attitudinal changes that need to be brought about. Patriarchy has been there for centuries. Now to change it'll take a long time, but then you can make a good beginning by including such topics in the syllabus of little kids, school kids. And I also believe that the media has a major role to play, the visual media. See the advertisements in the newspapers, see the advertisements in the televisions. And what about the movies? They all have been sending very wrong messages from the point of view of gender. So I think the script has to be very finely checked before it is being broadcast. So the print media, the news, the visual media, then the education system, then the discourses at home, all these things have to work together to change gender relationship.
Thank you. This is a very important, critical point which you've highlighted. And when we need to break the stereotype, men and women have to work together. And the role, one is highlighted the curriculum, and also highlighted about the role of media, which reinforces gender role. The idea when we are talking about DRR role, in 2-3 minutes we will be winding up, so we'll take one or two questions quickly. That in this context, how media could be influenced for the women leadership in DRR? As we are saying, they are reinforcing a stereotype role, but whether any dialogue with them can lead to some change at the local level or at the federal level, the national level.
Sir, that's right. If you kindly allow me, then I would like to put a point in front of all of you. It was a wonderful talk, and I was listening since the beginning. And rightly informed, the women leadership which we are talking about within this DRR system, in informal sector, it has achieved a change. In fact, in last 10 10, 25 years at least. But sir, in the formal sector, what I see that at the apex level, since the advent of Disaster Management Act, there is no women representation at the highest level, I mean to say NDMA. And the similar situation at the second tier management in this country, that are SDMAs. SDMAs also, there are very less women representation in the SDMAs. So, sir, somewhere when we are talking of filling the gaps, so at this central level and state level, when we are translating the entire action at the grassroots level, and grassroots is showing us some extraordinary results in women empowerment. But similarly, somewhere these gap at the national level will build up. Yeah.
Yeah. You have completed your point?
Yes, sir. Along with also there is one more important point here within India.
This question.
Yeah, sir. Yeah, this is a question, sir. How to fill the gap at the central and state level, and also within the National Disaster Response Force also, when they are going for the specialized search and rescue operations, there are women, there are many female who are pregnant and who deliver babies within the boats and within the camps, and there are no lady search and rescuers in the fact in the country. So these are 3-4 gaps actually in the, when we are talking about women leadership and empowerment, and that we have to fill at the highest level, and policy makers have to think about it.
Thank you very much.
I would like to respond to this question.
Yeah, please.
I think it's a very good point that has been made. At the present, it is true that the National Disaster Management Authority in India does not have a lady member. But in the past, there was Miss Madam Jyoti Rao, who was a member of NDMA earlier. But in the National Disaster Response Force, we have got the women contingents now. The women contingents are being trained, and very soon more and more women will participate. And here I would like to mention that there is an institutional constraint that there is no direct recruitment to the National Disaster Response Force. The people who come to the force are on deputation from other central armed police forces, where the recruitment already happens. And there is a need for women personnel in the other forces also, in the Central Reserve Police Force, in the Central Industrial Security Force. In every force, there is a need for more women. So therefore, those forces are not willing to offer women on deputation to the NDRF. That has been a constraint. So government has been attempting to increase the participation of women overall in all the forces, so that more women personnel will be available for NDRF. So that attempt is going on. Similarly, we are in touch with the state disaster management authorities and state disaster response forces, so that the participation of women will increase in all spheres. And in the National Disaster Management Plan for 2019, this is a point of inclusive development, inclusive DRR, which we have concentrated on, and we are in dialogue with the state governments to actually get this implemented. Thank you.
Thank you very much for making this point. Now, we wish to close this. We close. We need to have a last point from each of the panelists, one punchline from each. I would start from Margaret. Margaret, do you have to say any punchline which we can take it as a last point of yours? Margaret?
Okay, well, the disadvantage of going first is I don't have time to think. So I would say that my punchline is my key message, as I said earlier, which is that effective DRR needs women's equality, and it's for everyone. It's not just for women. It's not about power one over the other. It's for everyone. So, and we, you know, this is a long punchline now, but we have to make this happen. Thank you.
Thank you very much. Now I go to Vatsala, ma'am.
I think that women leaders are all there. It is for the for those in the DRR highest echelons to just discover them, not just at the highest echelon, even at the local level. They are there all around us, women leaders. Just find them, just discover them.
Thank you very much. Finding out them is a critical point. Suranjana, would you like to give your...
I think I go back to my same points. One is the benchmarking. What does inclusion of women mean? We have to include them as leaders. So what does that mean? We have to assign a role to them. We have to allocate money. You can't have any plan, any framework which doesn't have money to do the work. And there I feel that that's how the two are linked. You have to put money in the hands of all these groups that have been managing money for at least 15, 20 years now. So they have enough of a track record, they have enough of a history of managing money, and I think the last thing I would say is that you have to understand and support the social movements that have brought women to the level that they are now at, because that is what is making the difference today.
Thank you. Naseem, are you there? Naseem, you are not there. Can I have Mr. Rajendra Singh from Punchline, from the last point from him, before I request Sri G.V. Sharma to give the concluding remark? Mr. Singh, are you there? He's not there. Now over to Sri G.V. Sharma. I request him to give his punchline with the closing remarks. Sri G.V. Sharma.
I think we have to start right now. We have already delayed. So it is high time we started immediately for promoting role of women and in leadership, not as just recipients of our relief work, but as actual subjects in all aspects of disaster risk management, starting from identification of the risk. So we should start right now. I think this has been a very interesting and very participative session. Very good ideas have been thrown up and a lot of field experience has been shown. So I think we have learned a lot and we should move forward in more tangible ways of actually having community-oriented, participatory leadership for women, and for which all stakeholders have to come together and work together. So I compliment NIDM for having taken this initiative. I thank all the panelists and participants for making their efforts. Thank you very much.
Thank you very much for giving note as that we are already late and we need to start. There's no better punchline for the 2 hours deliberations which went on. And I'm really thankful to the National Disaster Authority, especially G.V. Sharma, who is leading from the front and identified those points and say that we can't wait for it should go parallelly. And all comprehending and taking up to this social vulnerability, environment, opportunity, and then voice from vulnerability leadership. I extend my heartfelt thanks to Sri G.V. Sharma for being with us for all 2 hours long sessions and giving insight and taking the pledge and giving the direction that we should start now. Thank you very much, sir, for you. And also we need to thank Sri Rajendra Singh, who mentioned about this different discourse and different cyclical engagement of women in terms of post-disaster response, recovery, relief management, and reconstruction, and then how NDMA can also help, and some initiatives which taken in the past. Thank you very much to you as well. Ms. Valsla giving a wonderful interaction and insights from the Kudum Sri and also the grassroots and mind-boggling example of early warning system from the grassroots and empowering women, how that women, if opportunity is there and they look for opportunity and leadership are already there, we need to have that. Thank you very much for being with us and giving this insight from the field and with your experience. Thank you very much from NIDM and NDMA. I also extend my heartfelt thanks to Suranjana, Naseem for being with us, highlighting the example of Maharashtra and how that thousands of women across the country, they are working in different states as an empowered women and already broken the stereotypes and showing that how this can be scaled up and can be supported from the highest institution of the country. Thank you very much to both of you. And last but not the least, Margaret Arnold. I always said that you are the champion women as a leader. I remember 25 years of continuous, tireless work on empowering women across the globe, and which you've been able to bring this sustainable development goal, climate change, and this Sendai framework together. And we say that if we are not empowering or bringing women into leadership, the whole society at loss. The economic cost of development would be much higher than what we actually going through. Thank you very much for taking your time in the early morning from the United States, and grateful to you for being with us. I extend my all heartfelt thanks to all the delegates, participants who are still there with us, and 454 participants joined today online, and thousands are viewing from the live from Facebook and YouTube. Thank you very much, and also raising questions. I thank my team from this National Institute of Disaster Management, Mr. Ranjan, Mr. Balu, Mr. Bala, who are providing all the support to Mr. Raka, and all the extended support given by the IT team, Mr. Balu, Mr. Bala, who is the in charge of that. Thank you very much to all of you. And I extend my heartfelt thanks to Major General Bindal, who is not here, but because unless and until he would have given this support, this would not have possible. So from NDMA and NIDM, I extend my heartfelt thanks. I, Santosh Kumar, convey my heartfelt thanks to all of you. And I would like to wish you all the best and very good evening to all of you. Enjoy your day, Margaret, and rest of the people in India can have a very good night, evening, or good evening to all of you. Thank you very much. And thank you for supporting.
Thank you, Mr. Santosh Kumar and NIDM and NDMA. Thank you.
Thank you very much. Thank you very much. It was really a wonderful learning experience to all of you.